Right, so let's just think about our connection first of all. So where we want to feel connected is underneath both our feet, underneath the lumbosacral junction, which is the junction between your lower back and your pelvis, underneath your TL junction, which is the junction between your upper back and your lower back, underneath both shoulder blades, and then underneath the back of the head. So we're just going to go through a few postural cues now, just work our way up, just to try and get you better connected. So thinking about the feet first of all, do the feet feel like there's equal pressure from side to side? If there's not, just try and shift the weight around a little bit so that you've got equal pressure. Does the weight feel like it's equal from side to side of each individual foot? So the outer and inner arch, does it feel equal, the weight distribution? If you feel like you're on the outside of the foot a bit more, just try and pull the inside of the foot down towards the floor, but trying to keep that arch in the middle. And then, or if you're feeling more like you've got weight on the inside, just try and pull that outer arch down, but stay connected on the inside. Okay, so now let's work our way up to our pelvis. So to get better connected between ourselves, the lumbosacral junction and the floor, we were going to just start by tilting the pelvis. So we're lifting the pelvis forward, so anterior tilt, and lifting the spine off the floor. And then we're going to reverse peel, so we're going to put the spine down towards the floor, and we're going to go into that posterior tilt, posterior pelvic tilt. And then we're going to pull away, so we're peeling the spine away from the floor. And we're just going to alternate between those two movements, so anterior tilt, posterior tilt, lumbar flexion, lumbar extension, lumbar flexion. So tilt back and forwards, and then you just want to stop in the midpoint between the two end ranges, where your lower back should be nice and flat on the floor. There shouldn't be a gap, you shouldn't be in lumbar extension, and that you shouldn't be arched into the floor, so your lumbar spine doesn't want to be flexed. So if your back's nice and flat, your pelvis should be in a neutral position, your lower back should be in a neutral position, and you should feel a bit better connection between your lumbosacral junction and the floor. So then we'll work our way up to the rib cage. So your ribs and your pelvis want to be parallel with each other. So what I mean by that is that you don't want your ribs to be in this kind of flared position. So imagine that your ribs and your pelvis are like the pages of a book, and this bit here is like the spine of the book. So you want to try and pull the rib cage and the pelvis together like you're closing the pages of a book, so that you lose the flaring of the ribs and you get that connection between the TL junction and the floor, so there's no gapping underneath here. Because when you've got this open book appearance, or this open scissor appearance, whatever you want to call it, you tend to get this lumbar extension. So we want to pull the rib cage and pelvis together, and then that way the diaphragm and the pelvic floor will be able to communicate better when we're breathing and be able to create a better stabilisation strategy. So now you should be feeling better connected between your TL junction and the floor as well. And then we're going to work our way up to the shoulder blades. They want to be equal from side to side, the pressure underneath both of them. And then your shoulders themselves, they want to be in a neutral position, so they don't want to be forwards in this protracted, internally rotated position, or elevated up by the ears. So we want to depress the shoulder, so pull the shoulder blade down towards the back pocket, and then try and imagine trying to externally rotate the shoulder. We don't want to take the shoulder into retraction. We are pulling it backwards a little bit into retraction, but into a neutral position. We don't want to be over retracted, because that's not neutral. So we're depressing, externally rotating and slightly retracting. And then we're going to work our way up to the head. So the back of the head wants to be connected with the floor. We want to push the head down towards the floor, so we'll get this activation in the deep neck flexors of the front. We don't want to go into neck extension, and we don't want to go into neck flexion. So we're just going straight back down, eyes looking at the ceiling. Okay, so now we should be feeling connection underneath both feet symmetrically, underneath the lumbosacral junction, TL junction, both shoulder blades and the back of the head. And you'll feel it down the back of the arms as well. So we're going to start with the breathing by just trying to get the breathing in the right order. So put one hand on the chest, one hand on the tummy. And for anyone who's done these before, just use this as a bit of a relaxation, meditation, mindfulness, whatever you want to call it. But for those who haven't done it, we're just going to work on trying to get the breath in the right order. So as you take a breath in, diaphragm should go down, and then that should create pressure inside the abdomen, which means that your hand on your tummy will lift on the breath in, and hand on the tummy will lower when you breathe out. So breathe in, try and focus on that hand on the tummy being the one that moves as you're breathing in and out. Hand on the chest doesn't want to move anywhere. Really focus on your breath, try not to let your mind wander, we're just thinking about what our breath is doing. If you're struggling to do this, you're finding it hard to get it in the right order, just keep practicing. Even when you're not doing these flows, just day to day, the more you practice, the easier it becomes, the more subconscious it becomes, and the less you have to think about it. Try not to be frustrated with it, because it will come eventually. Okay, so we've got the breath in the right order. What we want to do now is try and create this 360 degree of breathing. And when I say that, I mean the whole of the diaphragm wants to be working as you're breathing in. So, and when you breathe in, the diaphragm, like I say, goes downwards, and that should create a pressure called intra-abdominal pressure the whole way around. So you should feel all these muscles all the way around, so front, side, back, and your pelvic floor as well. You should feel those muscles kind of expanding. So your pelvic floor will mimic your diaphragm, and it will go downwards, or it should do. And all of the muscles around the waist should expand outwards. So to wake those muscles up, what you're going to do is you're just going to put your hands around your waist. So fingers around the bony bits, the web of the hand around the waist, and the thumbs into the back. And then to wake them up, you're just going to cough. Feel the muscles expand under your hands. And then now think about all those muscles as you're breathing in, expanding and trying to push your hands away. So this wants to feel equal from front to back and symmetric from side to side. So what a lot of people tend to do is they find it easy around the front and a bit more difficult around the back, or you might find it easier on one side than the other. So we want to try and get it more balanced out. So First of all, let's start by thinking about the front muscles. So they're the easiest ones. So if you just want to poke them, wake them up, cough again, feel those muscles, and now think about those muscles lifting. Breathe in through your nose, out through your mouth, through pursed lips, like you're blowing through a straw. I always struggle to inflate on the right hand side more than the left, so I have to really think about the right hand side. Now put your thumbs into your side and now cough again. Feel those muscles expand, and then try and think about those actively now, lifting and pushing your thumbs away. At the same time as the muscles in the front pushing your fingers away. And now grab into the back with the thumbs. These are the hard bits that people struggle with to activate. So again, cough, really wake them up, poke them, give them prod. And now really try and visualise your thumbs being pushed down towards the floor by your muscles in your back. Okay, good. And now we're going to activate our brace. So depending on what you're doing during the day, you will need different levels of activation of your brace, so different levels of stabilisation. Sort of day to day, your 360-degree breath is a perfect way of creating stabilisation in the spine and the rest of the body. But when you're doing things like carrying the shopping, carrying the kids, or lifting weights, you need to be able to create more stabilisation. So you need to be able to create a brace. And like I say, the amount of stabilisation you need varies depending on the amount that you're lifting. So to do that, what you want to do is it's an outward push. So it's not a clench, you don't suck your belly button in, you don't tense your tummy muscles. You want to pretend like you're farting, so you create your 360-degree breath, and then an outward push. So an outward push like you're imagining you're farting, and then try and keep the muscles active now as you're breathing in and out. So you've taken a breath in, you've created your 360-degree breath, you've created your outward push, so you've created that brace. And now you want to keep those muscles active as you're breathing in and out. So try not to let the muscles relax completely as you're breathing out. One more. Okay, so we're going to start the flow now. So you're going to remember your 360-degree breath, remember your brace for when you need a bit more stabilisation. Think about your posture, think about neutral spine, neutral pelvis, shoulder activation, neck activation, so everything wants to be as neutral and aligned as possible. So we're going to start just with doing some hip flexion, so alternating sides, so lifting one leg into the air and lifting the other leg. So this is the first step to teaching your body how to dissociate movement of the hip from the pelvis and the lumbar spine. So we want to be keeping the pelvis neutral, lumbar spine neutral. This movement is only coming from the hip. So obviously when you're doing a squat, we want to be able to flex and extend the hip without losing the lower back and losing the pelvis. As you're doing this as well, try and bring the leg up into a bit of external rotation, because flexion of the hip is coupled with external rotation, and we need external rotation to be able to squat. So external rotation of the hip to be able to squat. So alternating sides initially, keeping the lower back neutral and pelvis neutral. When you're bringing your feet up as well, try and bring your feet into a dorsiflex position, or not too dorsiflexed, but just in this neutral position with your foot pointed towards your head. So obviously what we want is when you were squatting, so this position is kind of like a squat but lay on your back. Your feet, you want dorsiflexion in your ankles to be able to squat properly. So alternating legs. And now we're going to bring both feet up into the air. So with this you want to create your 360-degree breath and your outward push. So you brace, and we're going to lift, because what we don't want when we lift is for the pelvis to tilt forwards, because you'll lose your pelvis and you'll lose your lower back. So we're just, this movement again is coming from the hip, but we're creating that movement using our core rather than just using the hip flexors. Do a couple more, and then we're going to stop in 3 months supine. Grab our TheraBands. So this is my new thing. I don't know whether it's going to work out all right. We'll try it. So in this 3 month supine position, so your feet, like I say, want to be in dorsiflexion, neutral ankle joint position. You want your feet slightly higher than your knees, knees over your hips, hips in external rotation. And then what we're going to do is just work a little bit on ankle mobility. So we're going to put the TheraBand around one of your feet. And we're going to stretch that into a little bit more dorsiflexion. So keep breathing. And then we're just going to push the foot up towards the ceiling. Try and make the foot glide in a neutral position, so it's not twisting inwards or outwards. And then we're going to pull the foot down into dorsiflexion again. Point up to the ceiling and pull down. So you'll feel that down the back of the calf, maybe down the back of the Achilles, might feel it in the sole of the foot. Your joint might feel a little bit jammed. Push the foot up again. Keep breathing. Try and make this movement quite smooth, not jaggedy. So keep pointing the foot, activating through those calf muscles, and then pulling it down into dorsiflexion, trying to get a little bit more range each time, like shaking. Swap sides. Okay. So stretching, feel that dorsiflexion, and point the foot and pull down. and up. You might feel that there's a difference between sides. I don't feel the stretch as much in this calf as the right side. I've got less dorsiflexion in my right hand side. This ankle's better range anyway, so that's maybe why I'm not feeling it as much, so you might feel the same. And let's do a couple more. Okay, now I'll take one leg over the other, so we're going to give the glutes a bit of a stretch. Just going to hold that. Keep breathing into it. Activating all those muscles 360 degrees as you breathe in. So you're basically crossing one leg over the other, so you're creating sort of like a 4 with your legs. Cross the other leg over. Again, you'll probably feel a difference between the sides. Again, my right side is a lot tighter, or feels a lot tighter, should I say. Couple more breaths. Okay, put the TheraBand away for a second. We're going to bring our hands up, and we're going to do, like, wouldn't be a flow without doing a bit of a roll, so we're just going to do a little bit of a roll, but that's not the focus for today. So we're going to lift the head up, look to the left, and we're going to roll onto our left hand side, nice and controlled. Try not to let the body disconnect. Make sure that the hips and the shoulders move as one, so we're not hips then shoulders, shoulders then hips. We're not flopping to the floor, so we're going to alternate from side to side. Really control. Make sure your spine doesn't banana when you're on the side, so keep a nice straight spine. Just do one more each side. And then you're going to come up into the lower oblique sit, and we're just going to go straight into a pigeon stretch. So from this lower oblique sit with your mermaid legs, and come in front of the camera, twist around, so pull one leg forwards and drop one leg back. Shoulders active, chin tucked, and then we're just going to lift up. So you're going to use, if your left leg is the one that's forwards and you're stretching your left glute, you're going to use your left glute and you're going to lift yourself up. So we're activating through that glute, and then we're just lowering ourselves, feel that stretch in the glute a bit more, and then lift. And lower. And do one more. And lower. Now come back into your high oblique sit, and then we're just going to grab hold of the light weight, and we're just going to do some lifts. So again, we're going to work on the hip hinge, so we want to be nice and upright here, so we're going to be hinging from the hip forwards. So pull the kettlebell up, and then you're going to use that lower glute to lift yourself up, and then we're going to lower, 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 lower. So this is going to be helping your eccentric contraction. The slower you lower down, the better you're working your eccentric contraction of that glute, which is really important when you're squatting. Lift. If you struggle and you feel like you're all cockeyed with this, get something underneath your bum and you can just lift yourself up a little bit higher, and because there's less range, it's a bit easier to do, particularly if your hip mobility is not that good. Careful with your knees with this, so the more you control it, the less likely you are to hurt your knees when you do this. Just do 2 more. You should really feel that glute working. Okay, so we're going to come now from this position, so come up again, pull that right foot forwards, down into the tripod, and what we want to do is, again, we're working on our hip hinge, so hands flat on the floor. Again, if you've not got the range, put your hands on a book, and we're just going to hinge backwards. Trying to get this movement to come from the hips. We don't want it to be affecting the spine. Feeling it down the back of the leg, the right leg. Okay. So, on to my next new thing. So what we want to do is we want to try and create a bit more dorsiflexion in the ankle. So we're going to keep in this tripod position, or maybe just lift up one hand, keep one hand down. Try and shift the knee forwards of the foot, and then what you want to do is go onto your tiptoe, so we're activating through those plantar flexors, and then lower and try and get a little bit more dorsiflexion in the ankle, and then up and lower. Good. Try and keep your posture active. Try not to let yourself round. Lift up and lower. Try and get a little bit more range in that ankle. Try and get the back of the ankle right down to the floor. One last one. Ooh, legs starting to shake. Working hard. Okay. Come up into your high kneel. So high kneel, foot flat on the floor, pelvis level with the floor. So try not to be all wonky, so that the front leg hip is higher than the other side. So we want to pull the pelvis level with the floor. Leg doesn't want to be too narrow, pull it out to the side. And then again, we're going to work in on our hinge. So find your neutral and then hinging backwards. And again, we're going to do the ankle, so up in this high kneel position, stretch over it. So try and improve that ankle dorsiflexion. So come this way. Go up onto the tiptoe and lower, and try and get the heel down to the floor and get that knee past that toe. Try not to let the knee cave in as well, so try and get that knee tracking that second and third toe. So onto your tiptoe, lower it down slowly, get that increase in ankle dorsiflexion. Lift, lower. I'm going to stop there because I'm really fatiguing now. My ankle's shaking. And then we're just going to increase that range again. So we'll increase that range in the ankle, but we're also just trying to stretch out that back hip flexor. Hold that position. Okay. A little bit of a shake off. Come back into your high kneel. Pelvis level with the floor. Curl the back foot under. And we're just going to stand. And lower the leg back. So as we go down and up, pelvis wants to stay level with the floor. So we don't want to be shooting out to the side. Knee doesn't want to be falling in, coming out to the side. So keep the pelvis level and up. Nice and slow down. Up. Nice and slow down. And then up. And we're just going to stay up now, but get your block or your books or whatever it is that you're going to stand on. And then get your kettlebell nearby. We're going to stand with the right foot forwards. Take that left leg backwards. Make sure you don't slide all over the place. And we're going to do some front foot elevated reverse lunges, or look like lunges. So we want to go down. Knee wants to come over the toe, so we want the knee to track the second and third toe. Pelvis to stay level, so don't let the pelvis shoot out to the side. And then we're going to come up. Down. And up. So by having your front foot raised, it allows your hip to get below parallel, which when you're doing a squat, that's what we want. We want the hip to be going below parallel. I'm not going to add a weight today because it's tricky enough as it is, but you can add a weight, and we just want to go nice and slow, really, really slow. So this really helps. If you have, when you're doing a squat, if you shift to one side, it could either be a lack of mobility on the side somewhere that you're going away from, or it could be a lack of stabilisation on the side that you go towards. So I tend to go towards the right. I think that's because my right side isn't as stabilised as the other side, or it's not supporting as well. So this is a really great way of trying to get that balance. Okay, so bring this leg back into this position and then lower yourself back down. Move this out of the way. And then we're just going to do a little bit of hip rotation. So bringing the knees up towards the sky. Like I said before, for a squat you need the external rotation in the hip. So we need to get the hips working well. So we're going to rotate from side to side. So as one hip externally rotates, the other hip internally rotates. If you don't have good mobility in your hips, when you do go to do a squat, you have to use your lower back more to get the squat. Try and be nice and upright in this mid position, well, in all of the positions, but try not to let yourself round when you go up here. And then we're just going to rotate one last time, round to the right. So now we're going to be in this right-sided oblique sit. Pull that leg through into pigeon. So we're going to do the same now, but on the opposite side. So feel that now on the right hand side. And lift, so use that right glute to lift and lower, lift, lower, lift, lower. We'll do one more. Lift and lower. Back into your high oblique sit. Grab hold of your weight again, and we're going to be doing some lifts. So we're hinging and we're lifting. This time using that right glute. So eccentric, nice slow on the way down, concentric on the way up. Really nice and slow, and lift. So keep doing that, keep lifting and lowering, nice and steady. Do one more. Put the kettlebell down, lift up, take that left foot forwards, and now we're going to do the hinge. So the tripod hinge, we're going to rock backwards, keeping the spine nice and straight. Backwards and forwards. And now come up, push that knee over the foot, and then we're just going to lift that onto the tiptoe and lower. Nice and slow. Feel that stretch down the back of the calf, so keep pushing the knee over the toe. Lift and lower. Lift and lower. Ooh, this is tough. And come up into your high kneel. So again, pelvis level with the floor, knee not too, or foot not too narrow, so out to the side, and we're just going to get the pelvis neutral, get it parallel with the floor, and we're just going to hinge backwards. Come up. So now push that knee over the toes, lift and lower and stretch a little bit further. Try and get the heel back down towards the floor. Just move over a little bit. And lift. Again, it's the eccentric on the way down. It's tough. Lift. Lower down. Try and get the heel to the floor. And then come up. And we're just going to get the pelvis balanced again, come forwards, and we just want to stretch that back hip flexor. And then come up. So now we're going to go into our stand. So keep the pelvis level with the floor. Knee tracking the second and third toe. Don't let your pelvis shift to the side as you're coming up. So curl the back foot under, come up. Take the back foot back. Lower down, keeping the pelvis level as you go. And then come up, bring the block back, the buff, whatever it is you're standing on. Stand on your left foot this time, drop your right foot back, and we're just going to be going slowly down and up, down, up, down. Try not to do it too far backwards, because what you want is for your ankle range of movement to be increasing as well. So if you're back here, we're not really getting that dorsiflexion. If you're doing it where your knee is over your foot, you get that range in the ankle as well. Just do one more. Bring this leg back now. Down, lower yourself down, put the books away. And now we're gonna bring that left foot in front of the right foot, right hand low in front of the right leg, right hand down, lift the pelvis, rotate the body, and then rotate round the other way. Lift, round, lift, round. Try and make sure your body moves as one again, so shoulders, hips move at the same time. Do one more each side. And then you finish it in bear. Lower down to quadruped. Just going to move this stuff out of the way. Then we're going to go down into low quadruped. So, low quadruped, quadruped bear, we're going to work on our hip hinge again. So, we want to get the setup right first. So we want about 90 to 120 degrees of hip flexion. So I usually settle around here. Forearms flat on the floor, middle finger in line with the forearms. Again, shoulders active. So we don't want to be rounded like this. We want the shoulders active. So externally rotated, depressed. You're going to push the floor away to activate through your serratus. And we want to work on with this. We'll find your neutral spine. Fix that point with your pelvis and your neutral spine. And then we want to work on our thoracic extension. So trying to get this upper back into a nice upright position, but without losing it. It's what a lot of people tend to do when they are fixed in this kind of thoracic kyphosis. They get really stiff through here, and they find it really difficult to dissociate the movement between the upper and lower back, and they think that when they're extending their upper back, they're actually extending the lower back. So we need to be able to extend the upper back, but keep the pelvis in a neutral position and keep the lower back in a neutral position, which is again really important for your squats. So thoracic mobility again is important for your like normal squats, not just sort of overhead squats. So come down into the low quadruped, find your neutral spine, and then work on trying to pull the upper back into extension without losing it into the lower back. If you feel like you lose your upper back, your lower back, keep your upper back where it is, and then just pull your pelvis into that neutral position again. And then we're just going to work on our hinge again, so hip hinge, so we're flexing the hip. So imagine that this is your squat, so we're going down into the squat, and we want to make this movement come from the hip, not from the lower back. Lower back wants to stay exactly where it is. And then come forwards, and as you're coming up, so we're coming out of the squat, what you don't want to do is lose the lumbar spine into extension. Okay, so a lot of people do that. They try and come out of the squat, they'll fall into this anterior tilt, lumbar extension, and you can just end up hurting your lower back. So find your neutral, hinge the hip. So constantly think about this movement just coming from the hip. If you feel like it's starting to come from the lower back, so if you feel like you're starting to round through your lower back or lose the extension, just modify it. Go really slowly, micro movements, tiny little movements to get yourself back into position. Again, keep working on that thoracic spine. Don't let that thoracic spine round. Try and make sure that when you're doing this as well, you're going straight back. If you feel like you're shifting to one side, just try and push down into the forearms equally both sides, and try and get your balance a bit better and push yourself back straight backwards. And now, if I've got enough room here, I'll move a bit. We're going to take one leg back and flex it forwards. So you're going to be pushing, if your left leg's moving backwards, push down into your right knee and leg, left forearm, and we're just going to be stretching backwards and coming forwards. Back, forwards. Again, trying to keep the lumbar spine neutral, pelvis neutral. Swap sides. Last one. Come up into quadruped, so you can see my head. Again, we're going to find the neutral spine, upper back into extension, don't lose the lower back, push the hands into the floor, shoulders active, chin tucked, and hinge backwards. And forwards, and back, and forwards, back, forwards, back, forwards a little bit. We're going to do that single leg hip extension as well. So find your neutral. And then we're just going to push down. So if you're moving your left leg, push into the floor with the right hand, left knee. Find your neutral. And we're just going to flex the hip on the right side, extend the left leg, and then come up. So you're going to flex the left hip and then extending Right. So we're going back and forwards. Nice and slowly. Try and make this movement come from the extremities, not from the body. So I can feel this work in my right glute now again. So we're working that flexion extension of the right hip. Now swap sides. So pushing the weight into the right hand, left knee, and coming backwards and forwards. I feel it in my left glute now. So eccentric contraction of the glute, concentric. Come back down into low quadruped again. Get your legs a little bit wider. So we're going to feel that stretch down the adductors. Make sure you've got your pelvis neutral, upper back neutral. And then we're just going to, again, flex the hip. Flex the hip. Feel that stretch into the adductors. Keeping the pelvis neutral, keeping the lower back neutral. And now come forwards, again keeping the pelvis and lower back neutral. Back down. So flexing, extending, feel that stretch in the adductors. On the inner side of the leg. Keep breathing, don't forget the breath. Last one. Come up again. So now we're going to go into our bear position. So find your neutral spine, upper back flat, shoulders active, curl your back feet under, lift your knees off the floor, and then we're just going to, so we want to try and make sure that as you lift, your pelvis doesn't tilt forwards. Keep the upper back flat, so create your brace, lift, lower, lift, lower, lift. And then we're going to stay in this bear position, try and keep the neutral spine and extend the knees, pushing the heels backwards, and extend and flex the knees. Try and make sure that your feet are in a neutral position. Try not to let yourself collapse onto the inner part or outer part. Lower down. Give your arms a little shake off. Just shake out your legs. And then curl the back feet under again. Find your neutral, upper back flat. Lift your bum up. And then we're going to hinge now. So we're hinging backwards again. Try and get this movement from the hip. Feel that stretch down the back of the Achilles. Try and mobilise through the ankles. Forwards. Try not to lose the lower back. Backwards. Forwards. Backwards. Hinging the hip. Forwards. Again, shake off. More challenging positions. And then, right place. We're going to go up again. Find your neutral. Shoulders active, upper back flat. Lift. And then we're going to walk our hands backwards into the squat. Come forwards a little bit, and we're just going to rotate round. So we're going to open up the hips. So rotate round, drop one knee to the floor. Feel that stretch on the inner thigh. Come back into the squat, back round. Again, feel that stretch. Alternate sides. Last one. Walk the hands back into bear, down. Give your legs a little bit of a shake off. Now, into quadruped. You can't see my head at the minute because if I go a bit further back, then when I go into my squat, you can't see me. So I'm just a bit further forwards now. So find your neutral, shoulders active, curl your back feet under, lift your knees, keep your lumbar spine, walk backwards into your squat. Okay, so we want to go from this squat here, try and be nice and upright, and then lower into your deep squat, and come back out into your upright squat, deep. So with the deep squat, you can go into this flex spine, upright. So I want to try and make sure that the hips are below parallel, but the spine is nice and upright. Down, up, upright. Put the hands to the floor, and then we're just going to try lift the bum into the air and lower. Just need to come forward, have a little bit of a rest, give the legs a shake off. We'll do that again in a second. So, neutral spine, shoulders active, curl the back feet under, lift, backwards, walk backwards, hands on the floor, nice and upright spine if you can. This is hard to do. Lift the bum in the air, lower, lift the bum, lower, lift the bum, lower, lift, walk the hands back out, stretch off, and now again find your neutral, shoulders active, curl the back feet, lift the bum, flex the hips, walk the hands back into your nice upright squat, and then stand and lower, stand, lower, stand. And then before we do our next squat, what we want to do is get our feet better connected. Make sure the pelvis is in a nice neutral position. So this is a nice little thing you can do before you do a squat or a deadlift. So I learnt this from Dr. Richard Ulm, best mention him, who is a chiropractor and DNS instructor. So you put your feet at your sort of like comfortable squat position, drop your knees inwards, so you feel the weight shift to the inner side of the foot, and then you want to rock forwards and backwards until your weight is equal from front to back. Now keeping that inner arch on the floor, don't let it lift. You're going to use your bum muscles to bring your knees outwards so that you can feel that connection now on the outside of the foot, but you've still got that lower foot, that inner foot connected. And you want to tilt your pelvis, find your neutral spine, and then lower into your squat and be nice and upright. Your feet should feel nice and connected. So I've come this way. Drop my knees in, forwards and backwards. Knees out to the side, neutral spine. Nice and upright. Come up. Try not to let your pelvis tilt as you're coming out. Try not to let it tilt as you're coming up. So keep it neutral. Legs are shaking now. Try and keep neutral the whole way down, so really slow it down. Try and make sure that you're going equally both sides. And come up.